Hey everybody, this is Paul from Ortho Eval, and with me I have Sean. Sean asked me to take a look at his knee today. He's been having problems for about 2 months now, correct?
Yes. Yep.
Okay, and you didn't do anything in particular to hurt this, did you?
Nope.
Just kind of slowly came on, and Sean likes to exercise. He's a runner, he bikes, he used to play men's basketball, he now coaches basketball, so he's got to be a little more cautious with, demonstration and stuff like that. Occasionally having some really sharp pain, but it kind of comes and goes. So nothing very predictable or nothing that he can really reproduce easily, okay? So the other thing I'm going to mention is that I'm just going to cut to the chase with the evaluation, not go through a long history. He's a healthy guy, he doesn't have any other comorbidities, and so we're going to get right into how I like to evaluate a knee without any diagnostic imaging or anything like that. So the first thing I want to do, Sean, is have you stand right over here, and you're going to face the camera, and we'll have you pull the front of your shorts up just a little bit, and let's have you scoot to the right just a little so you don't hit the wall. And I want you to squat for us, okay? So give me your best squat. Keep your feet flat on the floor and go as far as you can. Notice his knees cave in a little bit, his feet go flat, his calves are really tight, and come on back up. How did that feel?
Okay.
That wasn't too bad.
Nope.
Okay, so let's have you lie right down on the table with your head on the pillow. First thing I like to do is I like to see if there's any warmth in that knee from one to the other. So I just put a hand on this one, it's nice and cool. Put a hand on this one, and he's a little bit warm, kind of like on the medial side of the knee compared to the other side, just slightly warmer. The next thing I look at is I do a brush test to see if there's any effusion or if there's any superficial swelling. So the way I do that, I give him a couple rubs. I don't know if you can see this really well, Andy. And watch right here. Okay, see that pocket? We brush the fluid out and we run our hand on the other side and the fluid comes out. So this tells us he has an intra-articular effusion and something is causing that swelling inside the knee joint. Okay, so the next thing I want to take a look at is his active range of motion. So can you slide your heel toward your butt, please? Okay, and he has 130 plus degrees of motion. That doesn't hurt. Okay, and then come on back down. And when he straightens all the way out, what you can't see from that angle is that he doesn't quite extend all the way. He's lacking about 4 to 5 degrees of extension. Okay? So passively, I'm going to push him down. Any pain with that? No pain with that, but he is stiff, and mostly in the posterior capsule. Okay? Now we're going to check his passive range of motion and deflection. And oh, by the way, when we're extending him like this or hyperextending him, we need to think about what's happening. We're stretching the posterior capsule, but we're also compressing the front side of the joint. So if he had an anterior horn meniscus issue, that would hurt anteriorly, kind of in the anteromedial or anterolateral joint line. So I'm going to flex him all the way, stretch the structures on the front, and I'm going to compress the posterior horn of both menisci. Okay, any pain with that?
A little bit of what I was telling you about earlier, right in the middle.
Like a little pressure?
Yep.
Okay. And we're going to come back down. Next thing I want to do is I want to check his ACL. So I'm going to do a Lockman. I want you to relax. And he has a nice, solid endpoint and not a lot of laxity whatsoever. I'm going to check his PCL. We're just going to bend that knee just like this. And he has a negative sag sign. I'm going to put him here. I'll even do a little posterior jaw with him. No instability whatsoever. I'm going to check his medial capsule next in full extension. I'm going to give him a little pressure. Any pain with that? He's nice and stable. I'm going to flex him 20 to 30 degrees. I'm going to test him again. And I'm going to make sure that his hip is not rotating. So it's very stable. I'm going to take him out here. This is the best position to do the lateral side. So we're going to put him at full extension. We're going to check the capsule. No instability there, no pain there. We're going to bend the knee. And I'm going to do it again. Lateral, collateral, no problems there. Okay, so next thing I want to do is see if he has some joint line tenderness. This is where I start to palpate a little bit. Because remember, if it's an intra-articular problem, it could be a meniscus, could be arthritis, could be an ACL, but I think the ACL, PCL are good. We just check that. We're going to palpate the medial joint line. And he has a little bony ridge here. It's possible he's starting to develop some arthritis in that knee. Does that hurt? Okay, now I'm going to take the lateral joint line, and Andy, if you want to come around this way, we're going to bend both knees. Take a look at this, right over here. You're going to notice this is his lateral joint line, and there's some lateral joint line fullness there, and it's kind of puffy. Okay, so I'm going to follow that lateral joint line. Any pain?
A little tender.
So he has some tenderness
Yep,
right
there.
in through there, okay? So that's kind of posterolateral. He has joint line fullness, which is a sign of either lateral joint arthritis, but more oftentimes a lateral meniscus issue, okay? And when I flex him all the way, he has discomfort with that, especially in the posterior side of the knee. So it's possible he could have some meniscus issues going on here. So I like to assess the medial meniscus just like this. I put a little bit of a varus stress and I flex and extend him. Any problems with that?
Nope.
And it's not noisy. I don't get any catching or clicking. And then I will do his lateral meniscus. I put him into valgus and I flex and extend him. Any pain with that one?
Nope.
I get quite a crunch with that, but not bad, not very painful.
Nope.
Okay. So, you know, what I'm thinking right now is that he has some intra-articular issue. Either he has a meniscus tear, or he may have some underlying arthritis that is causing some swelling and inflammation inside his knee. I see no instability. He has no subjective instability when he walks or when he functions. And so what we're going to do is we're going to really try to optimize his quad function, not agitate his knee joint as much as possible, and see how he does over the next couple of weeks. If we feel like it's not responding, the swelling is still there, and he's still having problems with his ADLs, we are going to want to probably get an MRI and maybe even some standing x-rays to see if he has any arthritis starting. But before we get done today, I want to show you a Clark sign on him, and I want to show you that we shouldn't get too caught up with special tests all the time because he may have underlying issues that cause this. So I'm going to have him do a quad set right now. Tighten that muscle. Really tight. No problem with that, right?
No.
When I have him do a Clark sign, relax. I have him do that quad set very slowly. So I want you to go ahead and do that again. He can't do it. And it's very, very crunchy. It's like sandpaper in there, okay? But let's try the good leg. So relax. Okay, go ahead and try it. He can't do that either. It's very painful. So he has signs of chondromalacia, but he has it on both sides. And if the chondromalacia was the cause of this problem, you would see similar symptoms on both sides. But this knee is asymptomatic and he has great motion. He has no issues there, no effusion or anything like that. So I'm going to kind of discount that. I think he just has some early arthritic change that is going on, but I'm not going to hang my hat on a positive Clark sign just for that. So if you have any questions, so I guess what I'm going to do is talk to you about treatment. We're going to work on his quads, improve his flexibility, which is not great, and we're going to increase his patellar mobility and see how he does. If he doesn't do any better, then we'll look at the diagnostic imaging and go from there. So if you have any questions or would like to make any comments, please leave that at the bottom of this video. And take a look at some of the other links that I'm leaving in there. And we'll go to our knee playlist. We have all kinds of different diagnoses. And make sure you check out our new website at orthoevalpal.com. And please like our video and subscribe to our channel if you haven't already done so. Thanks and have a great day.